experiences that delight consumers and revolutionize outdated industries. The pandemic and advances in technology have accelerated the consumerization of healthcare. So friends, brads, ladies and gentlemen, let's welcome our second speaker, Heather Fernandez, is going to talk to us about consumerization trends in American healthcare. Heather, you have the floor now. Thank you.
Thank you, Koji. First, I just want to say hello to my mom and dad, Sanchi and Tony, and Auntie Delia and Uncle B-Boy. Hello. Thank you, everyone, for inviting me today. I'm going to talk about consumerization trends in healthcare. I'll start with a short video. I'll go through a quick highlight of the business that we've built and where we are. And then I'm actually going to share the key insights that led us to believing that we could build a company, an app in the United States to really be transformative in the American healthcare experience. And so, can you see my screen?
Yes, yes, we can see it, Heather.
Okay, we'll start with this.
"30 years ago, an ER doctor asked a very radical question. What if we were waiting for the patients instead of the patients waiting for us? And this one crazy idea led to a number of other really great ideas, like access to high quality same-day healthcare, being open 7 days a week after work and on weekends, providing visibility into how much is this actually going to cost. I know what you're thinking. These don't sound particularly innovative because they are what we have come to expect after decades of technology-based transformation in nearly every industry, but not healthcare. In America, 1 in every $5 of our GDP is spent on healthcare. And despite the many life-changing medical innovations, it is still the end-to-end experience of healthcare that remains largely unchanged. Until now. In fact, in every second of this talk, 5 people are experiencing convenient care in the way that first ER doc envisioned. And innovative providers and health systems across the country are taking notice. It's our mission to make sure that we're all no more than 3 taps on a phone away from a high-quality doctor today. Not 24 days from now, not whenever the doc can fit you in, and that we know how much that visit's going to cost us before it actually happens. The technology advancements that have changed all parts of our lives can and should enable consumers to live well, stay healthy, and get access to the healthcare that they deserve for themselves and their families, and provide a platform for innovative providers who want to put the consumer at the center of the experience. Now, let me tell you what I'm most excited about. This is a consumer-driven transformation. Industries and businesses of all shapes and sizes have shifted their delivery mechanisms, reduced the waste that they produce, changed their policies, even shifted the makeup of their boards because consumers demanded that they do it. Healthcare is next. Thank you.
I gave that talk probably 4 years ago now. And so let me just tell you a little bit of how we got to where we are. My background is nonlinear. I'm mestiza. My mom is from Nueva Vizcaya. My dad is from Iran. I grew up in LA. I started my career in politics. I worked on Capitol Hill. I worked on McCain's 2000 presidential campaign. I spent some time at Morgan Stanley after business school, a job that I did not love. And then I spent a decade building a company called Trulia, which it was a startup in the real estate space. I started when we were 12 people. We built that to fairly significant scale. And when that ended, I decided I wanted to take my career in a direction where I was taking what I knew how to do and applying it to a category where I felt like you needed innovation and change. So going back to 2005, buying a home in the United States was really complicated. There was not a lot of transparency. You oftentimes had to drive to your real estate agent's office, tell them what you were looking for. They printed something out on a piece of paper, pushed it across the table to you, and you drove around trying to figure out, what can I afford? And in 2005, there were 12 of us in the room, and we thought, given technology, this really should be better. I did a number of jobs over that decade at the company, but ultimately, we really were focused on shifting power to the consumers in real estate. Real estate agents are very important, but not to print out a piece of paper, rather to advise me. And the consumer should have control in their hand on their phone to understand, what can I afford? Where can I live? What is this neighborhood like? By February of 2015, when I left that company, we were seeing 51 million unique visitors per month. We were helping millions of dollars in closed transactions. And we ultimately sold that company for $3.5 billion to a company called Zillow. What that left me wondering was, now what should I do? My mom, who's not on this call, really wanted me to get a real job. But I thought, I want to build again. And I thought, how can I apply what I know how to do? And what we built at Trulia was a marketplace. How do I apply what I know how to do to build meaningful transformation in an industry that really deserved it? I had 3 kids in that decade that I was at Trulia. I became a healthcare consumer in a much more meaningful way. And I really became oriented on, can I build a consumer marketplace in healthcare? And what would that look like? Ultimately, that led us to this vision, which is everyone deserves to be free from the stress of everyday healthcare. And I don't know how familiar you all are with the American healthcare system, but the reality is it's the most broken industry that we have in the US. No disrespect to the doctors that might be on this call, but it is broken. Americans are paying $407 billion annually out of pocket for their healthcare. They defer care in massive amounts because there is a lack of access and a fear of cost. More than 50% of all bankruptcies in the United States are healthcare related. All the meanwhile, the largest players, the insurers, have a horrendous NPS, Net Promoter Score, which says, how happy is a consumer with the service that I get? And all of this is happening while the insurance landscape in the United States is also changing. What you're looking at on the right is the number of workers that have a high deductible health plan in the United States. What that effectively means is more and more of my healthcare spend is being paid out of my pocket, not by the insurance company. And so as a mission-driven individual, I thought, I need to build something in this space. And so what we've done is we've built a consumer app where within a couple taps on your phone, we aim to help you understand, where can I go for the problem I have? When can I be seen? And let me book that right now with a couple of taps. And then the hardest one, which is how much will it cost, right? 50% of bankruptcies being healthcare related is a travesty. It's why people avoid care. It's why they avoid that first visit, which ultimately ends them in the emergency room and hospitalized. And so we thought, let's solve that access to healthcare problem really oriented on these 3 questions. What we've done over the past 6 years is we've built a pretty massive experience. We built a consumer membership program where for a low monthly fee, consumers can have access to 24/7 care on their phone, as well as an in-person network in their community. And on the provider side, we've built a software that enables these innovative providers to modernize the consumer experience, meaning they need to run software in their hospital system or clinic or provider office that enables that consumer real-time online scheduling, SMS-based communication, digital paperwork. And what we do is we help modernize this experience and drive patient volume to those high-quality providers. And that's the business, the consumer app, the consumer membership, and then software sold on the provider side in order to enable that access. I'm pretty proud of where we are as a company. We've built the largest consumer audience in the United States for discovering everyday healthcare. And we have a really extensive national provider network running our software that enables us to deliver that better experience. 100 million Americans today are within 5 miles of a bookable same-day appointment. I'm pleased that someone on this call has used Solve, or maybe you know Solve from your local urgent care clinic. And this number on the right is astounding to me. I have a typo, but in 2021, 1 in 5 Americans came to Solve, solvehealth.com on the web or the Solve app looking for care. It's pretty massive growth over that period of time. Since we launched in 2016, we've raised $100 million to build this vision. And we've done it from the best investors that exist in the Silicon Valley that you see below: Benchmark, Acru, Greylock, and the Kaiser Family Foundation. And we've built an incredible team with an incredible culture. On the left, that's my co-founder and I, Daniele Fernetti. And on the right, that's 150 of us today, spread all over the country, although we are headquartered here in the Silicon Valley, building against this mission. And so going over to the insights, what is driving this consumerization in healthcare? And I'll share a couple of stories with you. But what we came to believe is healthcare in America is no longer exempt from the trends that are impacting every other industry, making it easier for consumers to get what they need when they need it, knowing how much they're going to cost. That was insight number 1. Number 2 is across many types of care, not all, access and convenience was more important than a specific person. Access and convenience to care is more important than Dr. Fernandez being there for certain types of care. And this one is important. And then the third one is even small prices matter when you are thinking about the consumer. And so I'll go in through each of these. First, healthcare is no longer exempt. So I have a number of logos on this slide that you might be familiar with. And when you think about big traditional industries that have been revolutionized in a way through consumer demand and technology and innovative supply side, as well as consumers, these are some names that I would highlight. I think everyone on this call is probably familiar with Uber and transportation. Airbnb started with a rent my space, rent my couch, and now is a global force in travel. I've mentioned Trulia, where I built that in real estate. Restaurants, there's a company, this is DoorDash, another one called OpenTable that has done the same. And then ultimately Solve, the company that we are building in healthcare. And so let me give you some examples from those companies. In 2011, getting a taxi cab was horrendous. What you did was you stood on a corner, you reached your hand out, and you hoped that someone came by. Fast forward to 2019, and Uber came on the scene. What they really delivered that was transformative was certainty. I know because I can see the car in my app telling me that that car will be in front of my house in 20 minutes. I know with certainty that it's going to be $24 to get me from this place to that place. The friction and uncertainty around, am I going to be safe in this car, went away. It was a massive transformation, which really shifted consumer behavior, not just in that space, but in many others. Second example I'll give you is travel. In 2008, your options were go to a big hotel, go to Craigslist. I don't know if you have that in the Philippines, but it was sort of like a posting board for services, which was kind of sketchy, or stay in a hostel if I wanted to travel. But what Airbnb did was bring transparency to something you would have never expected. Staying in a stranger's house. I'm going to stay in I've never met you, and I'm going to send you $1,000 and stay in your home, because what they did was real-time visibility from real consumers writing reviews about that extra home in your house, that extra room in your house. They told you this host is 5 stars. This host responds within 15 minutes. They engendered trust by being transparent about the supply in that marketplace, which was a home vastly expanding what it means to travel globally. And that was transparency. The next one is convenience, back to real estate. It was not convenient to find a home to buy, it was not convenient to sell or to rent. And what Trulia did ultimately was what we realized was everyone has a computer in their pocket. As I'm walking in front of a home, I should be able to see how much does it cost? Not just that, but what is the neighborhood like? Let me take all of that data that exists in the world and put it in the consumer's hand so that they can learn on their own, have that convenience, and then work with that real estate agent ultimately on the transaction, being much further along in their process. And then the last one I'll share is OpenTable. I don't know what the equivalent is in the Philippines, but in 2000 in the United States, in order to book a restaurant, what you did was pick up the phone and you'd call and say, excuse me, can you take 5 people at 2 o'clock? No, okay. Excuse me, oh, you'll call me back? Okay. Hello, can I get a reservation? No, okay. What OpenTable did was put that control in your hands. I want to book reservation for 7 people, French food, $3 signs, and I want to know that I can be seated at that time. It shifted the control from the restaurant to the consumer. And so when we thought about Solve, we thought these elements, certainty, transparency, convenience, and control, healthcare is not exempt from those. But the thing to understand about those companies is that they're not just focused on the consumer. At least half of their engineering teams are actually building software for the supply side of that market, right? Your Uber driver can't come to your door unless he's actually running the Uber app. So he sees where you are, how to get to your house, and he knows how much he's going to get paid. And so the magic of building a marketplace is you deliver on a consumer need and trend, and in doing so, you benefit, you drive dollars and revenue to the supply side of that market. And that really was our framing for Solve. Because in healthcare, 1 in 18 Google searches already are healthcare related. That's an astounding number. Just imagine 1 in 18 searches on Google. Consumers are looking for answers and having a really hard time finding it on the other side. 50% of millennials have no relationship with a primary care physician. The shortage of primary care physicians in the United States is extreme. That number is not just millennials, that really transcends all age groups. And when you ask consumers, what technology innovation would most meaningfully change your experience? It's technology from 2000. It's giving me easy online mobile booking so that I know that I can get to where I need to go, be seen, and then get on with my day. And so that's the first. Healthcare is no longer exempt. Second insight for us, and as you saw from my background, I don't come from healthcare, is that access and convenience are driving forces, driving consumer behavior. And what we were seeing was that access and convenience increasingly were more important than a known provider on the other side. Norman Rockwell has this wonderful painting that I think you might all be familiar with. This is not to say that primary care physicians and longitudinal relationships are not important. They are incredibly important. But the reality in the United States is that you have a shortage of primary care. And so the likelihood that you have a longitudinal relationship, depending on your demographic, more so if you're older, less so if you're younger, is increasingly low. And this really convinced us. What you're looking at is Google Trends. If you're not familiar with it, in your computer, you can put trends.google.com and put any words. And what it shows you is what is the consumer search behavior for those terms. And so we did this a million times, but what you're looking at here is urgent care is the blue, primary care is the red, and family doctor is the yellow. The insight for us was when consumers are looking for everyday care, because access is limited in the United States, they were shifting to this new modality, urgent care. Hello, whoever's yelling. Hi. And so what we thought was that urgent care is an interesting starting point for us, but really what this is a model that we made a bet that we would start seeing across more and more types of what we call everyday healthcare. And this is how we looked at it. I won't spend too much time going through this 2 by 2 because we'll be running out of time soon. But we looked at the billion ambulatory visits in the United States per year. Ambulatory visits, non-hospital visits. We put them on a 2 by 2 of what is the frequency in my lifetime. So this is an oversimplified 2 by 2. Left, low frequency, right, high frequency. And on the y-axis, what is my fidelity to the person? There's someone with a clanging. If you don't mind muting yourself, it would be really nice. And so fidelity to a person. And what we realized was access and convenience being critically important to get the care was really in this top right quadrant. Urgent care, retail clinics, telemedicine. And what we came to believe through talking to hundreds of consumers and providers, looking at the data across Solve, was that more and more types of care, what we look as this large blue box, we're really shifting to this model based on a number of factors. And what that gave us was an incredible addressable market for us to be able to build Solve as the place to go for everyday healthcare. Okay, the last one, small prices matter. In the United States, when people talk about prices, they talk about the most expensive 5% because they are extraordinarily expensive. But when you think about the earlier chart that I shared with you, that there's a trend towards high deductible health plans, which means that consumers are paying more and more out of pocket. What that means to me, the consumer, is I care. I'll go here. I care if it's $20 or $200 or $2,000. That matters to me because it's coming out of my pocket. I'll go back to this one. What you're looking at here is another chart that we built in the early days, long before we had any software live, which was when you think about the consumers in the United States, you have non-utilizers, you've got the 80% that go to the doctor, and then you have the top 5%, which are hospitalizations. What that dotted line is in the chart is your deductible, meaning once I hit my deductible, insurance will cover everything else. So what does that mean? If I need to have my hip replacement surgery, it's going to be very expensive. It's going to be covered by my insurance. Wonderful. Please send me to the most expensive place. But for everything underneath that line where I am paying, like I said, $20, $200, or $2,000, now I'm a more active consumer because I don't know if you know this, but 1/3 of Americans have less than $1,000 in their savings account. And so these everyday healthcare needs are the difference between food in my house, the vacation that I want to take, taking care of my car, and ultimately really matter to me. And so a great example of a company doing this in the United States is GoodRx. If you're not familiar with them, what they effectively do is say, for most generics, you can get them with a GoodRx coupon for cheaper than your insurance negotiated rate. What they made visible in the United States was that insurance doesn't actually mean the best price for me. Oftentimes, if I'm asking for the cash rate, that may be lower than the insurance rate. And so what we've done at Solve, actually this is not launched yet, it's launching in a few weeks, is what we're calling Solve Clear Prices, where for the top 200 services across the United States, we are sharing what is that cash price so that you, the consumer, can decide, I would like to use my insurance for this service, or I would like to use cash and not use my insurance for this service. It's a paradigm shift in American healthcare, which is underway today. Because ultimately, and this I think is my last slide, maybe one more, what we're trying to do is increase access, increase quality, and decrease cost, not just for the system, but for the consumer. And that is my story that I wanted to share. So Doji, I'm happy to jump
Hi.
into Zoom.
Okay. Hey, Heather, thank you.
Ah.
Awesome. Awesome. Awesome
you.
presentation. In
I told you I
Bisaya
would be
pa.
fast.
In Bisaya pa, daghag salamat. Daghag salamat, Heather. So before anything else, before we proceed to a few questions, maybe Heather can still take a few. Let's have a group photo, please. So
Oh.
those who are or whose videos are off, please turn them on. Angela, can you take a photo of the group? Okay, Sina pa. Fred, okay, Sigmund, Fred, Christopher, Claire, please turn on your video. Spines, Boy, Mark,
All right. So
Joey.
there are 2 pages po, so just hold your smiles. I'll count to 3. 1, 2, 3. Thank you. I'll go to the next page now. 1, 2, 3. All right. Thank you, everyone.
All right. Okay. So maybe are they okay? We're
to your birthday party. We're trying to have a
okay.
conversation. Hello,